Heart and blood pressure tutorial.
Hello, my name is Mitchell, and I'm going to be explaining the heart. So there are 13 parts of the heart, including the veins, valves, and arteries. Here they all are labeled. Part 1 and 2 are the superior and inferior vena cava. Their jobs are to bring deoxygenated blood from the body to the heart. Part 3 and Part 9 is the right and left atrium, and their purpose is to pump blood to the right or left ventricle. Part 4 and Part 10 are the tricuspid and bicuspid valves. The task of these valves is to control blood flow between the left and right atrium and the left and right ventricle. Part 5 and Part 11 are the right oxygen depleted and left oxygenated ventricles, and their jobs are to pump blood into and from the lungs. Part 6 is the pulmonary valve, and its job is to control the blood flow from the heart's right ventricle to the lungs. Part 7 is the pulmonary valve, and its purpose is to carry oxygen-poor blood from the right ventricle to the lungs. Part 8 is the pulmonary vein, and its purpose is to carry oxygen-rich blood to the left atrium. Part 12 is the aortic valve, and its purpose is to let blood flow through the left ventricle to the aorta. Part 13 is the aorta, and its function is to transport blood from the heart to the rest of the body.
In these scenes, we will demonstrate how to find heart rate and blood pressure. But first, what is heart rate? Heart rate is the amount of times your heart beats per minute. This is how we measure it. We count how many beats we feel in 15 seconds. Then we multiply the number we got by 4. And now, blood pressure. We measure it with the pressure on your arteries when your heart beats, systolic. And the amount of pressure between every beat, diastolic. This is how we use a blood pressure cuff.
Atrial septal defect. What is atrial septal defect? Hole in the wall that separates the heart's inner chambers. Atrial septal defect, ASD for short, Comes in two different sizes. Small ASD usually close on their own, but large ASD may cause heart damage if left untreated. Must be closed via surgery. Atrial septal defect ASD symptoms: shortness of breath, tiredness, swelling of legs, feet, or belly, irregular heartbeat, skip or quick heartbeats.